Welcome back to Voices of Dental AI. I'm your host, Loren King, Chief Evangelist at Trust AI. And this is a show where we dive into the intersection of dentistry and technology. We're going to highlight the innovators who are shaping the future of our profession. Today, I'm excited because this is someone in our internal family at Trust AI, someone whose work and vision have influenced thousands of clinicians around the world. I have Dr. Michael Wehrle today. He is definitely what I consider a pioneer in implant education. He's also one of the founders of the most prestigious global implant immersion courses and is recognized as a leader in advancing implant education and surgical training. So, Dr. Wehrle, thank you so much for joining us today.
Thanks for having me. I appreciate it.
What originally drew you into implant dentistry and what made you so passionate about teaching and pioneering implant education on a global scale? So, what motivated that?
Well, to be honest, I had to pay for the mission that I started down there. Everything I do is ministry based. It's all about helping your fellow man first. And in order to fund the ministry, I had to, because I have this whole center that is the size of the Mayo Clinic, and it started a Mexican dental clinic down there to pay for it, and it couldn't pay for it. So I said, all right, let's start doing implant training, because when I looked around, the implant training was extremely deficient. No one was using CBCTs. Everyone was using panos. Everyone was cutting corners. And I said, that's not the way to train, and it's not the way to treat people. So away I went.
Wow, I see that. Okay, so in your experience, what was the most difficult part of that?
The most difficult part is logistics. It's like anything in life. You want to build something great, then it takes time, effort, and energy. You want to cut corners and go faster, it does, but then your product's going to suffer for it. We didn't cut any corners, so it took a little longer to get started, but now that we have it up and going, we're acknowledged as one of the top teaching institutions in the entire world, let alone the US or Mexico for that matter.
Do you see Trust AI maneuvering into that?
Well, what Trust AI can do here is there is so much about implantology that is protocol based. So it's all about these rules. Don't go too far to this tooth. Don't go this close to the buccal. Don't go to the lingual. Don't go this far subgingival. All of this can be taught through Isaac. At least the didactic portion can. In the end, you still have to do hands-on, but there's a whole world of this that can be done. And I use it all the time. I call in, I'll ask a question on this, a question on this. A huge part of my job is talking to my students all the time because they always have questions. Not that I want to be replaced by Trust AI, but a lot of these questions could already be answered by Isaac. And considering I can only handle so many people and Isaac can handle the whole world, I think he's got an advantage on me.
You think so? Well, with moving into more of the education space, I feel like dentistry and especially implantology has changed drastically over the years. But from your perspective, what are the biggest shifts you've seen in how we train and prepare dentists today compared to when you first started teaching?
The biggest change that we've made now is that we all understand that it must be hands-on for implantology. Other things, you can teach math or arithmetic just by working with a book or a page. In the end, you've got to work on a human being, and it doesn't work with a pig head, and it doesn't work with a model. It's got to be live human tissue, and that has to be done in a very controlled environment and in a very with somebody trained over your shoulder. But before you get into that, there's a world of didactic that you need to do before that to get yourself prepared. And that's where Trust AI is invaluable, both before and in questions afterwards.
Absolutely. I couldn't agree with you more. I feel like when with something so delicate and something so hands-on, I never see it replacing it. I only see it helping it evolve in a better way in terms of the, like you said, the didactic portion of it, right?
That's the funniest part that I see all the time is I see all these haters out there going, AI is not taking my job. Dear have mercy. AI is not going to take your job. It's not going to start having babies. It's not going to be a problem for taking over the world or taking over your job or doing anything. In the end, after you get past the fear and all this, like Y2K, your life's going to be better for it.
How would you compare this to Y2K? I'm curious.
The fear and hysteria of people that aren't educated about it. I mean, look at how foolish we always all looked a minute after midnight when nothing happened. There's so much fear and hysteria to things that cannot be proven, and yet, especially in the world that we live in, with misinformation and disinformation, it's all over the place. I have no fear of AI. I embrace it fully, and I am hardly technologically driven. At 62 years old, I did not grow up with a computer in my hands and this, that. That's why I want AI, because it's going to make my life easier. Because what people don't understand about AI who haven't been exposed to it all, This is all native language. I can talk to this phone and tell it what to do, and it's going to do it. I don't have to know which button to do and this, that. Who's been on a Zoom call that's gone south on them? The answer would be anybody who's ever been on a Zoom call. And I'm not picking on Zoom. Zoom's great. But yeah, I'm looking forward to AI.
That's great. I feel like from what I've read about you, and I'm getting to know you as we work together as well, but I feel like from what I've learned, you've trained countless, it seems, clinicians in surgical precision and implant placement, right? But now we're seeing AI enter the space in areas like diagnostics, planning, surgical guidance. So how do you see AI complementing or transforming implant education and surgical workflows specifically?
It's going to make everything so much easier. This is the biggest development that I see, and the thing that I'm most excited about is right now, if you want to do exocad and then which is the digital planning of the restoration and digital planning of the guides, and you use mesh mixer and you use this, you guess there's all these different disparate parts and pieces you got to come together. And if you're a genius like Corey Glenn that's been doing this for 20 years, you can do it. If you want to start on a low level, you can do it. Already AI is doing exocad and doing the planning for all these things, so that the world's getting so much easier at all of these things. It's going to make all these aspects of surgical planning, guides, everything else better. And the better they are, and the more people can use them, the better their surgery is going to be. Because you got to know freehand. There's no change for it. But guides only help, just like AI, when judiciously used.
Right, exactly. How would you explain that to someone that is very skeptical of letting something like Isaac come in and help them evolve as a clinician?
That's so easy. Sorry. All you have to do is use it. All this fear and hysteria isn't from people who have used it more than once or twice. You go on and you start interacting and you realize you're just having a conversation and you get to dictate the conversation. Isaac doesn't dictate the conversation. So you can ask it any question in the world. And if you don't understand, unlike someone else in society where if you disagree with them nowadays, you're actually hated and vilified because, oh my God, you don't have the exact same views that I do. You can disagree with Isaac all day long. Is just say, oh, well, I would think this, I would think that. You just got to use it and you're going to love it. It's much more civil, intelligent discourse than I find out on the airways these days.
You're funny, Doc. But I agree with you, right? And when you talk about training the next generation, which is like the next piece of this conversation, I know that you've spent, like we were saying, you've spent so much time pouring into clinicians at every stage from new grads to advanced implantologists and the whole gamut, right? You've started your own center. But what do you think the next generation of dental professionals need the most right now to succeed? I guess necessarily, not just in technical skill, but in confidence, leadership, mindset, those things.
I'm actually going around all the dental schools in the US and Canada. I say I'm doing some of it, and my students are doing a lot of it, my graduates. I have a whole team. Everything's always team based. It's always body of Christ. And we're actually going into the dental schools and talking to them. They need a world of training because what they're being fed right now is that the DSOs are the one and only answer. And what they need to know is they can do it themselves. But to do it yourself, you have to embrace this new technology because it's going to give you an unfair advantage. Little Billy gets out of dental school tomorrow. He's not going to have my hand skills. I've been doing this for 35 years, and just like Billy, 25 years from now is going to be better than Billy is today. What he does have the huge advantage over me, he's very comfortable with technology. So if he embraces AI early when he gets out, his practice is going to be going at light speed. And guys like me that are sitting in a corner afraid, I don't want to change. I want to keep Eagle Soft and Dentrix and all that old slow stuff that nobody knows how to use. And you got your one person in the office. Oh my God, please, Janet, don't ever leave, because if you do, the whole office is going to fall apart. This is all native language. Everyone in his office is going to be using it. Everyone's going to be as smart as Isaac is, and boom, at lightning speed. That guy coming out of dental school has a huge advantage over a dinosaur like me who's just too stubborn to change. Fortunately, I'm not stubborn to change. I'm embracing it because I think I have to.
You do. In my opinion, as a clinician myself, and now, I'm on the business side of it as well with Trust AI, I can absolutely say it's not something that's going away. It's something that's going to evolve, if anything, right? It's just going to keep integrating, but also just keeping clinicians in the mindset of this is a tool, you're the final decision maker, right? I feel like across the board, everybody can agree on that from all the conversations that I've had thus far about AI, and anyone that's skeptical, anytime I remind them of that piece, they relax a little bit of, no, I still want you to be the decision maker because you're the human being, right? Do you agree with that?
Absolutely. It's
Yeah,
just that you have better decision-making abilities because you have better information at your fingertips, lightning quick. As fast as you can dial a phone and talk to Isaac or scroll it on a keyboard is as fast as you can get these answers. And every follow-up question that you can ever think of, you can sit there and talk to him for 4 hours. It's fantastic. Look, here's what's happening to us. This is a whole new age. I love the study of history. In the 1900s, the late 1800s, early 1900s, with the Industrial Revolution coming along, one of the great things was cars and planes. And people couldn't even imagine that. Oh my God, I'm going to keep my horse because it's going to beat out the car. How many people are riding their horse to work these days? There's
exactly.
nobody. How many people aren't taking a plane to fly around? Next to nobody. I mean, the bottom line is this is coming whether you want it or not, and it can be an incredible tool for you, or it can be the thing that you ignored so that somebody else used that tool, so you get left behind and you're riding your horse to work.
Absolutely. It's like the iPhone moment in dentistry, right?
Hmm.
It's this new piece of technology, but once you actually understand how it works and how it helps you, then you can't live without it, right? I can't imagine not having my iPhone everywhere. Now it's like
Hmm.
someone an organ away from me at this point. But there was one point in time where I was like, I don't want to text that takes so much time. Now I'm like, don't call me, please text me, right?
And I teach in Mexico. There is no one anywhere that I go that doesn't have a cell phone. The lowest employee, everybody's got a cell phone. It's going to be that way in dentistry through the next generation. The question is, how soon are you going to adapt versus how much energy you're going to spend fighting this? How soon are you going to get better? Or how long are you to sit on the sidelines till you're just forced to go in because your practice is going under because you can't compete with somebody else who can go at lightning speed? With the version we're talking about, I'm going to look in the patient's mouth. I'm going to speak into the air. The microphone's going to capture the fact that I called out number Mrs. Smith. He's a number 12 crown, build up in crown. Just as fast the insurance makeup is done, I can say, Mrs. Smith, what day's good for you? Oh, I like Wednesday nights. Boom, we've already got her scheduled and back. She doesn't need anything else. It's all done through the magic of this. And it is magic till you see it. And that's going to be something incumbent upon Trust AI is we've got to teach people how to use this and put this in something that's easy to digest and that isn't frightening so that people will embrace it. And how well we do our job at that is how successful we will be at getting Trust AI accepted in the dental community, which is where it should be.
Absolutely. Knowing everything that you know, and you're someone that I respect significantly because of your time in dentistry, right? I've been in dentistry for 14 years, it's half of the time, like less than half of the time that you've been in the industry, and you've seen so many aspects of it evolve and things that you've had to incorporate or not incorporate, things like that. When it comes to implantology, where do you see the mistakes happening now with like the newer grads versus someone like you that's been in for so long in comparison to AI as well?
The biggest problem is that they don't get the training, and if you're training this ahead of time, it will be able to tell you when you're violating those protocols because there are simple protocols in all of this. In the end, again, you have to learn the hand skills also. I'm not saying that AI can replace that. I am not saying that. I'm saying, again, this could be a great co-pilot that can make you so much better at planning these things out. If you go and you take my course, but man, it's been a while since I placed an immediate or something. I
Mhm.
have all these things on my website that you can go to. A lot of other courses don't have that. Once you leave the course, boom, your check's been cashed and you're done. You're on your own. You cannot be on your own. You have to have a mentor out there to help you to tell these things. And if you can't call the person who put on the course like we do with mine, then you're going to need something like Trust AI to run things past, say, here's my x-ray, here's what I'm planning. What do you think? He's going to say, oh, I think the angle's going to be a little bit off. You want to put it more in the cingulum. There you go. You're going to need somebody to bounce stuff off of. We're all spoiled. I'm in Dallas, Texas. You're in New York City, you got 8,000 people around. What if you're in some small town in Kansas or some small town in Greenland and there's nobody around? I had a patient just come back from a trip and he actually went to Greenland and his implant just got loose. All he needed was a driver to screw it back a little bit. He calls around, he finds a one guy and he says, "Well, come on in. I've got 4 different drivers. I'll try one." He screws it back in for him and he goes, "Well, if this happens again, who else can I call?" He goes, there's nobody else in Greenland that does implants. This is it, man. I'm the only guy in an entire country that does this. We all don't live in the center of a huge metropolitan area, and Isaac's going to be the great equalizer of knowledge because it doesn't matter where you are, what country. It's big in India right now. U.S. obviously has a much higher socioeconomic status than India, at least at this point in history. Well, they can use Isaac just as well as we can, and whether you're in Mike Wehrle in Dallas, Texas, or a recent grad in India, you have the same access to the same information. That's huge.
So, do you think it's going to be more of like a teaching assistant or a guide or something more?
There's no question. It's going to be a teaching assistant, and it will help you actually to make the guides that allow you to place the implants. You're going to get out of this exactly what you put into this. The more that you embrace this, the more that you use this. And that's why I'm going to the dental schools to get them now. And they're like, "Well, I don't run a practice. I don't need a practice management system." I go, "Da. I don't want you to do that. Just take the basic thing and start asking it questions. And start getting familiar with it so that by the time you graduate, it'll be like second nature. The same way all of you who are so much better at computers were using computers in grade school when I had to use this thing called a pen and a pencil and paper. It's crazy, but it's true.
You're giving me PTSD, doc. I remember my computer class, we were timed on how quickly we could type.
You could type today because of it. Look at it, Lauren. Thank God for your computer teacher, Mrs. Smith, that she helped you out.
Yes, she was a nice one, but I was very fast. And now it's critical, right? There was an article released recently in the AI world, the technology industry, where someone was stating that being skilled in prompting, so talking to AI, is going to be just as critical as knowing how to read and write.
He can actually learn even that from AI. You can say to AI, "What's the best way to prompt you?" "Oh, well, here's what you do." You can ask it anything. That's the thing is there's limitless knowledge. You just get to spend a little time doing it. I know, tear yourself away from Fortnite or whatever else you guys are playing and play a video game that's going to make your life better, especially dentists. I tell them this all the time. If you're going to play a video game, play ExoCAD or play Trust AI. At least you get better at dentistry instead of, I don't know, whatever, your golden tee, you're working on your golf game, your virtual golf game at that.
No, it is a public hazard for me to pick up a golf club, Dr. Worley. Nobody's safe, so we're not going to do that. But
Let's avoid that then.
we'll keep focused on AI. But in your experience and then thinking forward, do you think there's going to be a risk of, let's say, over relying on technology? And like, how do we keep clinicians sharp in their foundational skills? Like, I've heard people talk about, well, what if this makes us lazy? What do you think about that?
There was a Will Smith movie on that where they just sit around their little pods and they don't drive anymore. They don't this, they don't do that. Look, life is what you make of it. I'm a dentist, so I don't use my body. I use my mind and I sit here and I contort and this and that. So I should have all sorts of health problems and I should be overweight and this and that. I'm in great shape. I work out 1 hour every day because I know that about me. So you have to plan your life accordingly. You have to just do what you need to do in order to get this. So as far as AI goes, you're just going to have to use it, but it's not going to take over everything you do. And especially at this level, you want to talk to me 50 years from now or 40 years from now, and all of a sudden you're sitting around and they put a brain implant in and all that stuff, yada, 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 yada. Let's have that conversation. Right now, all this does is make you smarter instantly. But if I'm reading it off of here, or I'm searching through 12 different encyclopedias, again, going back to prehistoric times, to find the answer, but I'm still getting the answer. Did it make me better to flip through 100 pages to find it than just to ask Isaac about how I do an immediate implant that's got, where the patient's got some complications? I don't think so. I don't think that page flipping made me any better. I think it just wasted more time that I could have spent with Isaac learning even more.
Right, absolutely. I feel like it's also going to help in terms of the education aspect of it too, on a global perspective of we're all going to start being on the same page, right? The CEs that they're taking in Italy, Isaac can pull from. The CEs that they're taking in Egypt, Isaac can pull from. If there's someone in the middle of nowhere in one of these countries that is in the middle of an implant placement and they're struggling and they don't have anyone within range to refer to, stop the procedure, there's something serious going on, I need to refer you to someone else, they can't do that. So in my mind, and I would love your feedback on this, but in my mind, this also helps those surgeons as well, right?
There's no question. We're all going to learn and grow because the information becomes more readily available and the information gets incorporated in Isaac, so it keeps getting smarter and smarter. The people that are afraid of this, ask them this: do you own a computer? Well, of course I own a computer. I own a phone, I own a laptop. Blah, blah, blah. I get it. Everyone's a computer somehow, some way. Do you realize that the computer can be used for bad or good? You can do bad things on the computer, which we all know, or you can do good things. So, which is it going to be? It's the same thing with AI. You can use this to make yourself smarter and to do good things, or you can sit on the sideline and just waste away. And even someone who's an old man like me at 62 and been doing this for pushing 40 years, I can't wait for it to come out and I embrace it because it's going to be the next generation that makes all these computerized things easier for me, not more difficult. It levels the playing field between me and you now, Lauren, because I can't type, but I don't have to type anymore. I just voice activate everything.
There you go. You're going to be right there on my heels. You're probably going to be in front of me at one point, but that's okay, right? Because I think it's going to advance us all and it's just going to enhance the skills that we already have. I think it's only going to help humans evolve. We're not going to stay stagnant. It's not possible, not if you embrace this. Looking ahead though, what excites you the most about the future of implant education? So when you think about your own legacy, what impact do you hope your work will continue to have on dentistry for years to come?
The impact that I want to do is I want to be a great teacher and trainer. And what I'm excited about is harnessing the power of AI so that I can do that. Right now, Corey Glenn can make a guide in no time at all, and he can plan out a case. He can do this stuff. He's fantastic. And there's a bunch of other guys in the world that can do this, but not that many on a percentage wise compared to implantology. If we incorporate this correctly, and we're going to, and we use this knowledge, that's the kind of thing that's going to be available now to everybody automatically. You're still going to have to use your brain in the end and go, do I like the position of that? Do I like the size of the restoration? Do I like the emergence profile? It doesn't replace that. You still have to have a judgment call at the end, but boy, it's going to be lightning quick. And all of us are going to rise up. It's the old thing about when you're in a boat and the water rises and you all rise together. We're all going to rise together in this. It's not going to make us work. There is no way that, and I'll use a really long time frame here, that 5 years from now that the world's not incredibly changed by AI, and that means dentistry too. I got news for you. It's going to change in the next 5 months dramatically. The question is when you're going to get on board. 5 months or 5 years?
Dr. Wehrle, it's clear your influence in dentistry goes far beyond the operatory. You've shaped careers, you've expanded opportunities, you've inspired clinicians worldwide. So I want to thank you for joining us today and sharing your insights. And to our listeners, this is exactly what Voices of Dental AI is about. We're bringing you conversations with the leaders driving innovation and elevating our profession, just like you, Dr. Wehrle. So thank you for joining us.
Thank you, Lauren. I appreciate you having me on.
Thank you. And we'll see you guys next time.